Hello everyone, myself Garaj Dhruvi, and today we are going to discuss about CIMT, which refers to Constraint Induced Movement Therapy. In this introductory video of CIMT, we will be covering the following important points. Namely, point number 1, what is CIMT therapy? Number 2, how did CIMT therapy came into existence? Point number 3, what are the important components of CIMT therapy? Point number 4, what are underlying mechanisms of CIMT in neurological recovery? And last, where can CIMT therapy be utilized? Like in which kind of neurological conditions and in which kind of patients? So, CIMT, Constraint Induced Movement Therapy, can be defined as it is an evidence-based rehabilitation technique designed to increase functional use of weaker arm following stroke and other neurological conditions. This means that in this technique, the functional, or that is the arm which is normal, this arm has been constrained. That means it is restricted, and the use of the paralytic arm or the weaker arm is being facilitated. For example, if a patient's left arm is paralyzed or is weaker side, the therapist constrains the right side, that is the arm which is stronger or which is normal, by constraining it. The therapist constrains it by the use of bandage, gloves, splint, etc. The intention is that the patient should not be able to utilize the normal or the stronger side upper limb to perform the fine motor movements or any hand activities. It's like sending the normal side on a vacation where it has to do no work for a certain period of time. And during that same period, when the normal side upper limb is on a holiday, the therapist enrolls the weaker side or the paralytic side upper limb of the patient into an intensive training program, which we can call as a type of a crash course. During this period, the patient is supposed to practice and master many movement patterns and functional tasks utilizing the weaker side upper limb. The ultimate goal of the CIMT training program is to enable the patient to functionally use the weaker side upper limb automatically. That is, the patient should not be consciously thinking about using the weaker side of the upper limb. Now let's talk about how did CIMT therapy came into existence. Now this idea, constraining the stronger side upper limb to facilitate the functional recovery of the weaker side, was first proposed by Dr. Edward Taub. He was a behavioral neuroscientist from United States, has been credited for the development of constraint induced movement therapy in 1993. Dr. Edward Taub, along with his colleagues, were successfully able to demonstrate the neuroplasticity phenomenon as the mechanism of the recovery among stroke survivors following application of the CIMT training protocols. Now brings the third point of discussion: what is underlying mechanism for neurological recovery following CIMT training? And the answer is neuroplasticity. Neuroplasticity refers to the ability of the brain to adapt, repair and reorganize itself following a neurological insult or any kind of injury. Now coming on to in what conditions can CIMT training be applied and what are the type of the patient who can actually get benefited by getting enrolled into CIMT training programs. Researchers have shown CIMT therapy to be equally effective for both the pediatric as well as the adult age population. Main conditions in which CIMT training programs have shown significant improvements in the functional usage of the paralytic upper limb includes conditions like stroke, incomplete SCI, traumatic brain injury, Parkinson's disease, multiple sclerosis, cerebral palsy, etc. I sincerely hope that this video regarding CIMT was quite informative and helpful. Thank you very much.